All right, there is a guy in San Francisco who is trying to get enough signatures to put on the ballot in San Francisco a new law that bans circumcision for anybody under 17 years of age, feeling that it is at best ritual mutilation, at worst something worse.
Howard Stern would agree.
Doctor, and we know how Howard Stern feels.
How do you feel?
We'll talk about it. Dr.
Can I ask
Sonu,
who over 17 is good? Never mind.
May I do the introduction?
Yes.
Dr. Sonu Ahluwalia is with us.
You just like saying his name.
I do really well, though, don't
Sonu Ahluwalia. Welcome. Steve was very rude in the commercial break. He asked you if you were circumcised, and you said no.
It was a fair question, was it not?
Yes.
Yes.
Absolutely.
Yeah.
So you're for it?
No, you go ahead. Yours, that's much more interesting.
Yes.
Okay, well, there you go.
Yes.
So we have one of each.
One of each.
I feel like I get circumcised here every morning.
That's a whole other circumcision.
I had my son circumcised, and yes, Steve was there, oddly enough. And yesterday, two people here said to me, you know, I was there too. I was the worst day of my life.
It was a party.
I do not remember.
We had sponge cake.
Why was it the worst day of your life?
Well, because I'm holding my son while he's being hurt.
Oh my gosh, you held
Was he
him?
anesthetized?
A little bit.
Okay.
I have a question. You did it at home, right, Dorothy?
Yeah.
And don't they wait a few days to do it?
Yeah, a week.
A week?
7
Okay,
weeks,
so
right.
I did mine in the hospital. I made my husband go. I said, I can't. This is horrific to me. It hurt me so hard, so much.
I held my son's leg, although I must say I was looking at you, which is just weird. But
And I was getting a little reaction.
But you know, anesthesia is not used everywhere. And we think that
it's often not used.
Right.
Why?
And we're going to let you talk, I promise. And
Why is it
was
not
never used except for a little bit of wine in the old days.
Yes.
And that
So
was
why
it.
would they not use it today, doctor?
because not everybody who performs it is a doctor.
You have to. But a mohel is not necessarily a doctor.
So a
and they
mohel
don't
won't use.
They can't.
Not always.
Yeah, but they do. If you have it here in Los Angeles.
And the thing is, it's so simple. There's a cream. It's called EMLA. You just apply
cream.
it. Right, that's it.
But let me tell you, how do we even know that? I mean, I've used EMLA for laser hair removal, and it's still friggin' painful.
That's why we're on TV. We want to tell people, use EMLA.
Yeah.
Okay.
It used to be thought,
Yes.
and you talk about it, but it used to be thought that
Look at
babies
these
at
babies.
48 hours, where basically it starts up to a week, feel nothing. And when they would,
How do we know?
When,
No, he cried. Mine cried.
When they would cry, you'd say, "Oh, they're just reacting to what's going on." We don't think that any longer.
No, we don't think that. Now, we can't have conclusive studies because we don't know, but we believe that sometimes these kind of things can cause psychological trauma, even with mother-child bonding. I mean, you're exposing this child to pain. We don't know for sure, but we think.
You know what
maybe.
he's-
Thanks.
Yeah.
Because I didn't feel guilty enough about it before. Can't we blame the father? He's Jewish.
Why
It's
do we
David's
do
fault.
it? I know it's tradition and this. What's the stigma? My uncle didn't get circumcised, and then when he was 33, he had problems, and he had to do it then, and it was quite painful. So this movement, do you think it has any legs?
Well, you know, if we look at what the advantage and disadvantage of doing this is,
Right.
Till about 2007, we didn't really think there was any medical advantage to having a circumcision.
So it was just for religious
It
purposes?
was just for religious or cultural purposes.
Or cultural,
right.
okay.
But they did these studies in Africa where they were looking to see if there was a decreased incidence of AIDS transmission if he was circumcised versus not. So if the woman has AIDS and a man who doesn't have AIDS has sex with a woman, is there a less chance that he will get AIDS if he's circumcised? And the answer was yes.
And this study was done in Africa where they still perform female genitalia mutilation, where they cut your clitoris off without any anesthetic, and they stitch you with thorns. Do you know about this?
Yes.
I mean, that's a huge problem.
It is. Let's focus on the male
Yeah.
circumcision.
Yeah,
Yes.
yeah, I know, and we're running out of time. And there's more information we need here right now. I know we're running out of time, but we're going to stay here for a moment. The disadvantages are.
None that we know of. We think that maybe there's less sensation because there's a lot of sensation in the foreskin, but other than that...
Some people believe,
Yes.
religiously, it's the Abrahamic covenant with God. That's your sign of your covenant with God.
Yes.
And also believe that it is a way to keep your sensual nature down.
Yes.
Is there any proof of that?
We don't know because you can't really tell, right? Because
We
either
can't
you-
interview the kids at that point, yeah, and then later on. All right,
it's
thank you,
hard to
Dr.
talk to
Ahluwalia.
Basis. And Robin Quivers.
And Robin Quivers. Yeah.
Interesting interview.
Right.
Well, I'm not gonna video